Welcome back from the break. Let's now talk health because the Global Fund has issued a final warning to Ghana demanding immediate clearance of tuberculosis and malaria medications that arrived in the country last October. According to the fund, despite assurances from the government, a portion of the shipments remains stuck at the port and can expire. In April, the Ghana Revenue Authority announced it had secured the tax waivers to enable it to clear the drugs after months of delay. However, demurrages and third-party charges are amounting to 7 million cedis, which must be paid. Due to this debt, more than 118 containers are stuck at the port. Meanwhile, members of the country coordinating mechanism of the Global Fund in Ghana have threatened to hit the streets on June 25, 2024 to register their displeasure over the government's inability to clear the remaining consignment of medical supplies shipped into the country by donors. The group lamented that there were 120 containers of medication from the Global Fund left to be cleared at the port, but the government was not attending to the matter with urgency it desired. Let's now speak to the president of the Coalition of NGOs in Health, Bright Amisanyako, joins me on phone for a conversation on this. Good afternoon, Bright. I am definitely sure you're disappointed in the government for the situation at hand right now.
Yeah, good afternoon, my brother, and then good afternoon to your cherished viewers. And then thank you for having me for this engagement. We are grateful you have received copies of our release and then you are sharing with the public. I think for almost about a year, as we describe now, there has been some commodities stuck at the port for quite a long time. Though we acknowledge government has made efforts in clearing them, we thought the pace was very slow, and then unfortunately we've gotten to where CSOs are agitating with their members in the community to demonstrate so that all the goods are cleared. We acknowledge the government's effort in getting these things to be cleared. I know they have put in a lot of energy to waive off tax, the AU and then the ECOWAS taxes on them together with other things. We have had some couple of engagements, and it's just that it's been too late. And the clearance has been too late, and then we are not too comfortable where it's gotten to now.
That as the medical supplies have been stuck there for a while, they could expire.
Yes, exactly. I'm only happy that as of today, I am told that they've cleared enough of all the medical supplies, the ARVs, the malaria commodities, and some TBs. If that is the case, we are yet to ascertain the fact. If that is the case, at least that alone will give us some relief if it is. So we are looking at the expiry on these medicines, which are closer in the coming year. Probably from January upwards, we'll be experiencing some expiries of these drugs. And then already there were existing shortages in the system when we talk of TB commodities. So our fears was getting people die out of avoidable deaths, and then and the expiry of these commodities that will call for additional expenditure to even destroy them. So we in as much as we feel that government is doing the best it could do in this hard time, we're also afraid that we could incur additional cost on the country using it to destroy commodities, and as well getting people lose their lives out of an avoidable death. And these have been some of our fears that we entertain. And we needed to mount pressure on government to get these things cleared for us, the community, to use them.
So you are telling me that as of today, some of the containers have been cleared. Do you know the number of them?
So as of our engagement with the necessary, the ministry and the other institution, the GRA, about 64 more containers have been cleared, which contains a number of commodities. I think over 2 weeks now, and then they are making plans to get the others cleared, and that is hopeful to us. So we are working to get establish the truth about these things, get the needed documents,
okay,
to be able to note that yes, truly these ones are out and then have been shipped, have been transported to the central medical stores, and we are in the process of transferring them to the regional medical stores for distribution, and that will give us some relief, as I said earlier.
Okay, Mr. Msanyaku, kindly hold on the line. Let's get to the NHIA, because the authority says it has disbursed over 300 million Ghana cedis as claims payments to healthcare facilities nationwide. This amount is set to cover the claims vetted for higher tier facilities up to January 2024. In a press release dated June 11, the authority indicated that the release demonstrates NHIA's commitment to maintaining the smooth operation of healthcare services and ensuring the sustainability of the National Health Insurance Scheme. The acting chief executive, Dr. Wajid Acosta, explained the disbursement aims to enhance the quality of care provided to all NHIA's members and support the operational needs of healthcare providers. The NHIA acknowledged the cooperation and patience of all healthcare providers and assured them of continuous efforts to improve the efficiency and timeliness of claims being processed. And let's get onto the phone lines and speak to. Okay, so Mr. Msanyaku, to this particular story where the NHIA is saying that they have, given out some money, do you think that the 300 million cedis is enough?
You agree with me, my brother, it's not enough. The government has owed the NHIA over the past 8 months to the tune of about 2.4 billion Ghana cedis. And if we should hooray 300 million Ghana cedis, though I agree it's substantial money, it will not be able to cater for all the claims for the past period that they have owned the service provider. And very soon after this disbursement, they will come back to us, calling on the government to pay the remaining. It is a step in the right direction, I acknowledge that. But if you look at the quantum of money owed by government to this, the authority, it becomes very insignificant as we talk about 2.45 billion Ghana cedis, and paying 300 million out of it is remaining about 1 point something billion, 2.1 over 2.1 billion. And it's still very, very substantial amount to be able to cater for the rest of the service providers, so that we continue to receive medication in the facilities that we go. So government has taken a bold step, but we wish it could do more. It is still a worrying situation, and we expect that NHIA comes back to tell us that at least more than half of the money is being paid to them, and then we would have a very comfortable feel between now and then January as we talk. Because we all understand the way it is calculated. It is not like government is owing so many periods. For now, if even it's about 8 months, the service provider that has given out services need to be paid. And 300 million out of 2.4 billion is not enough. Okay.
Thank you very much for your time here this afternoon, Mr. Bright Msanyaku, and he has been talking to us about the medical supplies stack at the port, and of course the NHIA's release of 300 million cedis to healthcare providers. Let's wait.